So now we are going to discuss next nephrotic syndrome, which is FSGS, focal segmental glomerulosclerosis, right? So this is called as focal segmental glomerulosclerosis, right? FSGS, focal segmental glomerulosclerosis, as we have learned earlier also, this is the most common cause of nephrotic syndrome in adults, right? So remember this point, they are the most common cause of nephrotic syndrome in adults. Most common cause of nephrotic syndrome, right? So most common cause of nephrotic syndrome in adults. So this point we have to keep in mind. What are the different etiologies or pathogenesis of, what are the different etiologies of the FSGS, right? So when we talk about etiology of the FSGS, either it is a primary, means unknown, or it may be secondary. So it may be secondary, primary or secondary. So in this secondary, they can be secondary to any other thing which will cause scarring or loss of kidney tissue, right? Scarring or loss of kidney tissue will be responsible for secondary type of, right? So this secondary can be due to infections, right? So this secondary can be due to infections, and in infections I would like to write HIV as a number one, right? So HIV infections, right? HIV infection, one of the important thing, right? Here I would like to tell you, in HIV infections, what are other glomerular pathologies we can see, which was the PGI question, right? So what are the other glomerular pathology in HIV infections? HIV infections, FSGS, membranous glomerulonephropathy, membranoproliferative glomerulonephritis, right? So these are the glomerular pathologies which we can see in HIV infection. And out of all these three, what is the most common, right? So remember, FSGS is the most common association with HIV. So in HIV infection, most common is the FSGS, right? So infections, then it can be due to heroin abuse, right? So it can be, second etiology is the heroin abuse. It can be due to morbid obesity, here I would like to tell you one important thing. Whenever there is a scarring, as I said you, right, it is due to the scarring or loss of tissue. So whenever there is a scarring, there will be more collagen deposition, and that is how sclerosis develops, right? And that's what you can see, name itself is reflecting, focal segmental glomerulosclerosis, right? So in this case, what we are observing, that there is a scarring, right? So there is a scarring, and whenever there is a scarring, there will be increased collagen deposition. So this scarring, what are the reason for this scarring, right? So number one reason for scarring, right? So number one reason for scarring, which was the question in All India NAIMS exam, was the reflux nephropathy, right? So in reflux nephropathy, what is the most common glomerular pathology, right? So that is the FSGS. So reflux nephropathy, most common is the FSGS. This was the AIMS question also and All India question also, right? So reflux nephropathy, you will see the scarring, right? So reflux nephropathy in hypertensive nephropathy also, right? So when a patient is having hypertension, so because of the random and fast blood flow, there will be damage to the glomerular capillaries, there will be scarring, and that will be also reason for the development of FSGS, right? So it can be due to renal ablation also. So whenever you cut down a piece of kidney, right, renal ablation, right? it can be seen in sickle cell anemia because of the ischemia, necrosis, infarction, fibrosis, and scarring, right? So that is why in sickle cell anemia also you can find, and even in case of IgA nephropathy also you can see this. IgA nephropathy also you can see this FSGS, right? So these are the various etiologies of the focal segmental glomerulosclerosis. So here I have said you only two, right? Primary, secondary. Now there is a third etiology, that is the hereditary, right? So here what we need to understand, that in secondary, sorry, here we have to understand that third main etiology for development of FSGS is the hereditary. Hereditary. In hereditary etiology, these are associated with the mutations in the genes, right? And that was the question in all India exam many times, right? And already we have discussed, right, what are the genes involved in nephrotic syndrome. So all those genes are associated with development of FSGS. What are these genes? These genes are NPHS1, NPHS2 gene. You remember all those things which we have discussed in nephrotic syndrome, alpha actinin 4, right? And TRPC6 gene. So all these genes which are responsible for nephrotic syndrome, they are associated with hereditary form of the FSGS, right? So these are all associated with hereditary form of the FSGS. Here I would like to tell you one important thing which examiner may ask in future exam, right? In nephrotic syndrome, because of the FSGS, there is having increased risk of FSGS, and renal failure. So increased FSGS and increased risk of renal failure is associated with apolipoprotein L1 gene sequence, right? So ApoL1 gene sequence variation on chromosome number 22, right? So remember, increased risk of FSGS is associated with apolipoprotein. What is this? Apolipoprotein L1 gene. Apolipoprotein L1 gene. So apolipoprotein L1 gene is associated with the increased risk of FSGS and renal failure, and these genes are present on chromosome number 22. So that is also one important thing which we have to keep in mind, right? So chromosome number 22, ApoL1 gene is having association with increased risk of FSGS, increased risk of renal failure, right? So this point we have to keep in mind. ApoL1 gene sequence variation on chromosome number 22 is commonly associated with FSGS and renal failure, right? So these are important regarding pathology of the, or etiology, sorry, these are important regarding etiology of the FSGS. Now we will see what are the findings we are going to see on microscopic examination. So when you see the microscopic examination, especially the light microscopic view, as you can see, the name itself is telling FSGS. If you look at the name FSGS, right? So if you find that F stands for focal, right? S is for segmental, focal, segmental, glomerulo, S for sclerosis. So glomeruli is showing sclerosis. And what do you mean by sclerosis? Sclerosis means collagen deposition. Sclerosis means collagen deposition, right? So focal segmental collagen deposition, this will be seen in microscopic view of this kind of renal biopsy. So what is the meaning of this thing? So now I will explain, right? Suppose you are seeing a renal biopsy. Suppose I am just showing you, this is the view where I am showing you three, right? So here I am showing you three glomeruli, right? So these are the three glomerular capillaries or Bowman capsule containing glomerular capillaries, right? So what I said, focal segmental glomerulosclerosis. Focal means not all three glomeruli will be affected, right? Focal means only one or two will be affected, right? So here I am showing you this one is the normal, this one is the normal. So that is the meaning, right? So this one is affected, this one is affected. So that is why we are calling them as a focal, right? That is why we are calling them as a focal. So not all glomeruli, only some glomeruli will be affected, right? So see, two are normal, one is affected. What is that problem? In that affected one, even in this capillary, if you see this capillary, not the entire capillary will be having collagen deposition. Only some areas like this will be having collagen deposition. So that is called segmental. Some of the segment of capillary is having, so that is the meaning of segmental. So now you can see this is called segmental. Segmental. And what is the problem? It is collagen deposition. So in this segment you are seeing collagen deposition is excess, and that is why there is a collapse of glomeruli. So they will be having collapse of glomeruli. So focal, segmental, collagen deposition is causing collapse of the glomeruli, right? So that is the meaning of focal, segmental, collapse of the glomeruli, right? So this is the finding which you will see in light microscopic view. On histological examination, there are 4 or 5 subtypes. So there are subtypes, histological subtypes, I should say. These are the histological subtypes of the FSGS, right? So what are the histological subtypes of the FSGS? Number 1 is called glomerular tip variant. Glomerular tip variant. Second is collapsing variant. Number 3 is perihilar variant. Perihilar variant. Perihilar variant. Cellular variant. And fifth is not otherwise specified. Not otherwise specified. So these are the 5 histological subtypes of the FSGS, right? So these are 5 histological subtypes of the FSGS. What are the questions which examiner had asked? Glomerular tip variant will be having best prognosis. So glomerular tip variant is having best prognosis. Can be a future question in your exam, because this was the older question. Who is having worse prognosis? Collapsing variant is having worse prognosis, right? Collapsing variant will be having worse prognosis. So that is the important point to notice down here is the question regarding which subtype is having good prognosis, which subtype is having bad prognosis. So collapsing variant subtype will be having worse prognosis, and that is why we are anticipating glomerular tip variant will be having best prognosis, right? So these are the histological findings, right? On immunofluorescence microscopy, second microscopy when we are going to use immunofluorescence microscopy. On immunofluorescence microscopy, what are you are going to see? You are going to see immunoglobulin M. So IgM plus complement deposits will be present in the sclerotic area, right? So those who are sclerotic areas where collagen is depositing, right, in those area you will find these things also, right? So sclerotic areas will be showing IgM antibody and C3 complement deposits, right? On electron microscopy, coming to the electron microscopy, what are the things you are going to see? So again I would like to draw a glomerular capillary, right? This is the capillary basement membrane, right? And there are podocytes, right? So these are the podocytes. Capillary is lined by the endothelium, right? So glomerular basement membrane will be having collagen deposition. So here they will be having some amount of the collagen deposition, right? Then what is the characteristic feature or hallmark of FSGS, right? So this visceral epithelial cell, this podocyte, we also call them as a visceral epithelial cell. So this visceral epithelial cell damage is the hallmark of FSGS, right? So always keep that in mind. Visceral epithelial cell damage is hallmark of FSGS. So visceral epithelial cell damage is hallmark of FSGS. So what is that visceral epithelial cell damage? What kind of damage you will see? Hypertrophy and disruption. So what kind of damage you will see? Hypertrophy and disruption. So there will be hypertrophy and disruption. So that was the question in older All India exam also, right? So hypertrophy and disruption of visceral epithelial cells are characteristic of the FSGS, right? So here, because of the hypertrophy and disruption, what will happen? There will be diffuse effacement of the food process. So here we will notice that there is a diffuse effacement. So you will notice that visceral epithelial cell, there is a diffuse effacement. So now you are seeing another one where damage has occurred, and because of that you are seeing all these marked arrow areas showing diffuse effacement of visceral epithelial cells. So now I am showing you here another important finding is the diffuse effacement of visceral epithelial cells. So diffuse effacement of food process, right? Diffuse effacement of food process, diffuse effacement of food process of the visceral epithelial cell, food process of the visceral epithelial cell. So this will be the finding, right? So there will be hypertrophy and necrosis of the visceral epithelial cell. Because of that, diffuse effacement of visceral epithelial cells will be visible on electron microscopy. So these are electron microscopic view. Now there is a one important thing which we need to discuss here for exam point of view, that is called HIV associated nephropathy, right? So FSGS with HIV. What is this? FSGS in HIV case. So FSGS in HIV case is called FSGS, HIV associated nephropathy. This is called as associated nephropathy, HIV associated nephropathy. In focal segmental glomerulosclerosis, what we have seen, only focal area will be showing glomerular capillary collapse, but in this case, in HIV associated nephropathy, there will be complete collapse, right? There will be complete collapse. So complete collapse. So what is the difference? Here you will find complete collapse of glomerular capillary. So complete collapse of glomerular capillaries will be there. Complete collapse of glomerular capillaries will be present, right? So complete collapse, and that is why this is also called as collapsing. So histologically they are collapsing variant of FSGS. So collapsing variant of FSGS. So they are collapsing variant of FSGS, and that is why HIV associated nephropathy will be having worse prognosis, right? So you remember, collapsing variant will be having worse prognosis, so they will be having worse prognosis. So these are some important points we need to understand. HIV associated nephropathy is a FSGS seen in HIV patient, right? And in that kind of patient, what kind of nephropathy you are going to see? Collapsing variant of FSGS will be seen, and they will be having worse prognosis. Another important feature which we need to understand, on electron microscopy of the HIV associated nephropathy, there will be one diagnostic finding, and that diagnostic finding is tubuloreticular inclusions. So tubuloreticular inclusions within endothelial cells. So within the endothelial cells you will notice tubuloreticular inclusions which are formed of endoplasmic reticulum. So what are these tubuloreticular inclusions? These are the endoplasmic reticulum due to interferon treatment, right? So because of the interferon treatment given to HIV positive patient, so endoplasmic reticulum will be having alterations, and they will be visible as a tubuloreticular inclusion. So they will be visible as a tubuloreticular inclusion. So this tubuloreticular inclusions within the endothelial cells are diagnostic of the collapsing type of FSGS in HIV patient, right? Now you can see this picture. What I'm going to show you, it's light microscopic view. In this light microscopic view, you can see the collagen deposition here. which is looking pink in color, right? So here you can see collagen will be pink or this thing. So these are the normal glomerular capillaries, right? In entire glomerular capillary, you can see that all area of the blood vessel is not having collagen deposition. How you will identify collagen deposition? See this pink area, right? This pink area, this entire area, you can see so much of pink thing. These nodules are the collagen only, right? So these are the collagen deposition. So these are the collagen deposition, and because of the collagen deposition, you can notice the lumen we can see here is not visible here because this collagen deposition is causing collapse, right? So this is the focal. So this is the focal involvement, focal and segmental. So focal, segmental, collagen deposition. So this is the FSGS. You can see here also there is a collagen deposition, there is a collagen deposition, right? Because of the collagen deposition, this capillary is getting collapsed. So focal segmental glomerulosclerosis. So that is what its name says.